Hey everyone, it's just Dr. Bart here. I just want to go through the terms and conditions for our clinic at Newcastle Cosmetic Doctor for 2025. So we follow the strict guidelines from APRA when it comes to informed consent. And when it comes to informed consent, we go through all different parts. The first thing is, what does the patient actually want and what's their desires? And the second thing is building a plan and communicating with the patient to see if it is actually possible. Now, if a treatment I think is not going to work or it's not worth its value or there's risk or safety, we won't do it. The next part is sort of talking about sort of contraindications. So, are you pregnant? We cannot do it. If you are breastfeeding, we cannot do it. If you've had previous allergic reactions or something like that, or immunocompromised, there's a good possibility we can't. Other things we talk about are the risks. So, are the relative risks, such as adverse reactions, such as might get a bruise or a little lump or swelling in the area or a little bit of pain for a short term. And then talk about like serious complications like vascular occlusion, blocked blood vessels, or an infection or granuloma. So there are other things we do. But the good thing at Newcastle Cosmetic Doctor is we have strict protocols for everything, whether it's consent, whether it's an adverse reaction, whether it's a complication, or whether it's a follow-up. We follow strict guidelines and policies per APRA. All our follow-ups are 14 days post-treatment and they're at zero cost. All our follow-ups you do not pay for, and it's a free consultation. We prefer with the anti-wrinkle dermal filler to wait 14 days. However, if you're really worried or upset or think that there's something seriously wrong, please contact us at any time and come into the clinic as soon as possible, because if it is a serious complication like an infection or a vascular occlusion, we want to get on top of it straight away. So every single patient after we talk and stuff, I said, look, contact the clinic anytime. The phone's not manned 24 hours a day, 7 days a week, but you can contact us on any social media and I check it every day. So, yeah, I think it's very, very important. Then after that, we talk about the treatment, what the outcomes are, what the expected outcomes are, and we build a plan. But I think it's very important for me is not to upsell or push product. It's more about building a relationship with the patient on trust. So what would I do if that was my family member? So for me, if it's your first time, start small. Just get a small, a little bit of anti-wrinkle somewhere that's in a really predictable place, like the frown line or somewhere. Or if it's dermal filler, start with just 1 mil and see how you like it and come back. I always say, if it's your first time you've come here, book in a follow-up 14 days after and come and see me so I can check it, make sure it's perfect and talk to you about it. And then over time, you build trust. And once you build trust with a relationship with your patient, it becomes so much easier, the conversation, because, the patient's had experience with anti-wrinkle dermal filler or laser treatments. And the second thing is they trust you. They know that you're not there to try and upsell them or push product or something, that you generally mean well by them. And I think therapeutic relationships are built on communication, so you've got to listen to your patient. Always sit back and listen for 5 minutes. Say, have you had any previous treatments before? And what did you think about it? Did you like it? Did you not like about it? What did you like about it? What didn't you like about it? Has anything ever happened that you didn't like? Did you feel heavy in the brow or whatever? And from this, I can sort of gauge from there what I can and what I can't do when it comes to a particular treatment, and sort of hopefully save them the issue of that same problem happening again, even though it's the first time I'm seeing them. So also, through the Privacy Act 1988, everything's confidential. So whatever a patient says, or all that documentation on the computer and everything, is purely confidential, and it's not for anyone else to read. Hope that makes sense a little bit about sort of informed consent. I know I'll probably miss a few little things here and there, but that's how I sort of break it down. I'm sure I do a lot more to it. Like, you sign paperwork and you read it and stuff, and you read about the complications and the adverse reactions and how long it can last, of course. But the main thing to me is communication, like communicating with your patient and building that relationship built on trust. And the only way you can do that is by being honest and being real, and looking after them, like putting your patient first, not thinking about money, not thinking about, what can I get out of this from this patient, but actually caring about them. And I think if you have that mentality in cosmetic medicine, you'll do well as a professional, whether you're a nurse, doctor, you do well. If your mindset is purely, what can I do to this patient to make him happy, and in every possible way, whether it's firstly safety, second thing treatment, third, outcome, and fourth, follow up. Give them that opportunity. If they do need a follow up, come in, please, anytime, and come in anytime. It's free. I want to hear about it. I want to know. I want to fix it for you, because if you've got happy clients, you have a happy day. And I think when I come to work, I don't come to work to make money. Yeah, of course you make money, but I come to work because I really enjoy my job. And I hope that gives a little bit of insight about how I treat, or how I do informed consent in the clinic. Of course, there's lots of ticks boxes and stuff like that, but this is just a general overview of your psychology, of how you think as a doctor or a nurse, and what are your, like, what would you say? What are your sort of intentions? So my intentions are purely for my patients is, how can I make them feel good? How can I do it safely? And how can I do it that they're happy, and they get good value for money. And the fourth is, how can they feel secure enough to come back, that if they do have a problem, they don't feel unsafe to contact me and say, hey, Bart, can I please come in for an appointment? I'm a bit unsure if this is a bit uneven, or this has happened, or I've got a bit of movement here. I want my patients to be able to do that and feel safe, and know that when they do come in, the first thing I'll say to them is, thank you for coming in. I really appreciate it. And if everything I do in the clinic, the main thing I love more than anything is when a patient feels comfortable to come back with maybe not even an issue, but something they're just unsure about, and feel safe to say it. So I hope that helps with other clinics or other injectors out there, about sort of your psychology and ethics of why you do it. So thank you very much for listening, and have a fantastic day.